Now, health experts are raising an alarm over the emerging surge of HIV and AIDS cases in counties that traditionally had a few cases. These stakeholders are converging in Mombasa for a 3-day stakeholder conference dubbed Maisha Conference to review lessons from HIV and AIDS responses. Dr. Ruth Laibon, the CEO of the National Syndemic Diseases Control Council, in a pre-conference media briefing, revealed the challenges of emerging pockets of epidemics in counties that did not traditionally have HIV progress and has been made in counties like Homa Bay. Dr. Laibon said they are observing a spike in cases in counties like Samburu, Mandera, and Garissa. She has meanwhile observed that men and boys' adherence rates to antiretroviral drugs are quite low compared to women and girls, though HIV is more prevalent in women and girls. NSDCC is advocating for early diagnosis of men and boys to prevent HIV-related deaths. Dr. Laibon has further called for cooperation between positive expectant mothers, doctors, and the community for them from suffering from stigma and discrimination that stop them from accessing medication.
Men and boys, the adherence rates to antiretroviral drugs is quite low as compared to women and girls. And although HIV is more prevalent among women and girls, we lose more men and boys to HIV because of one, they don't come to the hospital early. We only get them in the TB clinics, and when they are sometimes very sick or they've been sent to the hospital because of pneumonia or any other disease. So that's a challenge we have, and what we are trying to do now is to talk about early diagnosis of men and boys, because that is also a huge challenge. We're also having a challenge of emerging pockets of epidemic in counties that were not traditionally having HIV. While we are making progress in counties such as Homa Bay, the ones that Professor spoke about in the western part of the country, we begin to see counties, especially those that were traditionally not mentioned around HIV, like Samburu County. We begin to see the cases spiking up in even the far northern part of the country. We have Mandera coming up. We have counties such as Garissa. While the cases are few, we are concerned that if nothing happens, those few cases, if they remain unchecked and people don't access treatment, then we would have a challenge. So the Triple Threat Campaign, this is an initiative that is trying to seek commitment from all the stakeholders, both the government as well as communities.